The content of this video is not medical advice or a substitute for physical therapy. Please consult your physician or physical therapist before starting any exercise program.
Today I want to talk to you about wrist pain, specifically the type of wrist pain that arises from doing exercises in all fours or from a plank or push-up position. Now, unless you've had a wrist fracture, a wrist sprain, or some sort of wrist surgery, then in all likelihood, your wrist pain is arising from shortness in your forearm muscles, really the wrist flexors, the muscles that pull your palms down. So then you ask, well, what causes shortness in my forearms or in my wrist flexors? And the answer is anything that requires you to grip or grasp, like driving your car or lifting your computer bag. Typing would do it, as would mousing, right? Pretty much everything we do all day is going to lead to shortness in those muscles. So in today's video, I'm going to give you a couple of exercises to help you restore normal length to those wrist flexors. And at the end, I'm going to give you a modification you can start using right away as you're restoring that length so that you can keep enjoying those exercises that require you to be on your hands. All right, now for our first exercise, all you need is your hands, so you can literally do it anywhere. What I want you to do is put your hands together as in prayer position, and then you're simply going to raise your elbows as far as you comfortably tolerate it. Now, when you do this, it brings your wrists into extension or backward bending. So this is extension, this is flexion, right? So backward bending, and that's the position that's required for you to exercise on all fours or in push-up position. Now, what I want you to do is hold that position for about 2 seconds, 2 Mississippis, and then you're going to lower your forearms. Now, what I love about this exercise is that you'll feel that you press the pads of your fingers together as you raise your elbows, and that's important because it lends a little bit of extra support to the wrist joint. It creates a little suspension around the wrist using the muscles and fascia of the hands, as well as a little bit of those forearm muscles themselves. And that keeps your wrist from feeling so compressed. And we're going to cue you to do that very thing, to use the pads of your fingers in the next exercise as well. So this is a good place to get used to it. Now, I want you to practice this little prayer exercise, raising the elbows 8 to 10 times, holding for about 2 Mississippis each. But here's the important piece. I want you to practice it only every other day. And the reason for that is we're asking for a lot of these important structures around your wrist to change. We're asking the forearm muscles and the associated tendons to lengthen. We're asking for the ligaments to get used to a new position and ultimately the load of your body weight over them. And therefore, we need to build in some recovery time. If you don't, you're just going to make your wrists increasingly sore. So 8 to 10 times every other day. Now, after you've done that for about 1 week, you can transition to this next exercise. So the next exercise is going to put you on your hands and knees. And wait, before you freak out, don't worry. I know being on all fours hurts your wrists. However, we're going to do this a little differently. So what I want you to do is sit back, so keep your hips back on your heels and have your hands spread out in front of you. So you can see this really opens up this angle at my wrist here. So I'm no longer at that right angle at the wrist, which is what hurts. Instead, I've got this nice wide angle, and it's really important that you start in a place of ease. So make sure that you're not feeling any compression or pain here wherever you need to be. So some people can start a little farther forward, others need to start all the way back. And then what we're going to do is press into the pads of the fingers. See, that's where that little tip of suspension comes in. Again, you're actually supporting the wrists with the muscles and fascia around the hand. And then you're going to start to shift your body weight forward over your hands, only as far as you comfortably tolerate. Hold for 2 Mississippis and then come back. So you may find in the beginning you can only get this far and then you hold that for 2 Mississippis and come back, and that is just fine. So start wherever you start, 2 Mississippis, and then come back, and you're going to practice that 8 to 10 times. Now, over the course of a few weeks, and yes, it probably will take that long if you do this right and you give yourself that day of recovery in between, you should find that you are able to tolerate more and more angle at the wrist until you can tolerate being at a right angle. Now, before I show you the modification I want you to use until that day, I just want to remind you that if you find this helpful, please click like, subscribe to my channel if you haven't done so already, and please, please, please share this video with friends and family that you think would benefit from the information. I really appreciate your helping me get this information out to those who want it and need it. All right, now for the modification. What you're going to need is a couple of hand towels, and all you need to do is fold them first lengthwise and then crosswise, and once they're folded crosswise, you're just going to roll them up. And we're going to place those towels in the position where our hands are going to be. And then what we're going to do is give your hands little high heels. So you're going to come forward into all fours, and you spread your fingers and press the finger pads into the surface here. But you've got this little high heel under the heel of your hand so that you can see the angle at my wrist is not nearly as great as it was when it was at 9 degrees, right? So this is a much wider angle, much easier on my wrist. And from this position, this is a nice stable base. I can do planks, I can do push-ups, I can do whatever I need to do because I'm in a nice strong position with my hand and wrist, but it's not nearly the amount of compression that I would experience if I was flat on the surface with my hands there. All right, I hope you found this information helpful and that you are well on your way to improving your ability to tolerate exercises in all fours. And so until next time, keep moving and be well.